So hi, everybody. As Michelle said, my name is Alissa Terry. I've met many of you. I've been a genetic counselor for about 16 years and have been working with NYMAC for about 6 now. We're so grateful to see so many familiar faces and new faces today, as we just saw. It's great to have new people coming. We're so glad you decided to join us. I'm really excited to share with you what NYMAC has been working on over the past year and help you find resources to take with you back to your work in genetics. We'll be using the breakout rooms and interactive activities today to enhance our discussions about these topics. I do not have any relevant financial disclosures. So as you may know, and likely just heard from Michelle earlier today, NYMAC stands for New York Mid-Atlantic Caribbean, and we are a regional genetics network, or RGN, that's part of a system of 7 such networks that work to improve access to genetic services, especially for underserved families. The RGNs are supported by the National Coordinating Center, or NCC, which is housed at the American College of Medical Genetics and Genomics. We'll put the link in the chat now. Additionally, the National Genetics Education and Family Support Center, or Family Center, is a key part of the system. The networks work closely with families and family organizations, NSGC, ACMG, our genetics training programs, other genetics organizations, regional healthcare providers, public health professionals, and many more. So I'd love to get a quick sense of who is in the meeting with us today. We're going to share another quick poll, just like Michelle just did, to see what types of stakeholders are with us here today.
So Alyssa's Erica. I'm just watching the numbers come in, and I will, when it slows down, I'll give the countdown and share the results. You'll see them.
Perfect.
We've got over 100 people participating in this poll right now.
Great.
It looks like it's slowing down, so I'm going to end the poll in 3, 2, 1. There you are.
Great. So lots of genetic counselors and genetic counseling students. Great to see people from public health and early intervention. And close to 10% families and family advocates. I know we saw pretty good representation from that group in our registration. So hopefully we'll see more people from that community join us later today. We had a nice session with Lynn Perry and some of the families this morning. So welcome everybody, and thanks for sharing kind of what part of the genetics world you're coming to us from. So again, as you may know or have heard from Michelle earlier, our region includes 10 jurisdictions. So Delaware, DC, Maryland, New Jersey, New York, Pennsylvania, Puerto Rico, the US Virgin Islands, Virginia, and West Virginia. So we're going to put another quick poll up just to get a sense of where you guys are coming from today. So share with us what part of the world you're coming from.
These answers are coming in really fast. So
it's an easy one to answer, right? That's quick.
Quick to find the answer to this. So I'm going to close this one in 3, 2, 1. There you go.
I think we have someone from every NYMAC jurisdiction, so that's a win. Yay. And 7% from others. So we'll hear more at some point about where the rest of you are coming from our other bucket. But welcome to Puerto Rico and the Virgin Islands. We're excited to have you here. Okay. All right. Okay, so in a nutshell, what NYMAC does with our grant funding is to try to improve the genetics delivery system through collaboration with diverse stakeholders, and you're going to hear a lot over the next few days about collaboration. We support telemedicine projects to make genetics appointments easier for families, and we provide education about genetics to families and professionals. And all of that is really to achieve access to quality genetic services for families with genetic conditions. This is our general NYMAC flyer to share with others about what we're working on. I know it's very busy, but it gives an overview of our mission and resources for the year, which I'll walk through in the following slides. You can find this flyer on our website. We'll drop that link in the chat right now. Please feel free to share that with others. And it is also available in Spanish, and we'll share that link too. So I would love to learn more about ways that the audience we have with us right now has engaged with NYMAC in the past. So I'm going to ask you to put in the chat now if you've engaged with NYMAC in some of these ways. So have you worked with us on a funded collaboration? Have you used the website? Have you attended a webinar, been to another annual meeting? Have you done our telegenetics training? Are you on a NYMAC team or the advisory committee? Are you a student working with NYMAC? Tell us about yourself. See lots of different stuff. Website users, students, team members, telegenetics training. There's Pat. Pat does everything. And some brand new people too that just heard about us. Kristen Cruz, Lynn Perry. Hi, guys. Genetic Navigator training. Yes, Rose. Thanks for that one. TC, definitely a bit of many things, that's for sure. Perfect. Thank you for sharing all that. That's great. So if you're relatively new to us and you're not quite sure what your role is going to be or how you're going to fit in or how NYMAC is going to be useful to you, these are just some of the options, and you can kind of see how the other people on the meeting work together with us. And we hope that by the end of these 2 days, you'll find some great ways that fit your life to work with us. So we do hope that our NYMAC website will become a go-to resource for all of you. We'll drop that link in the chat so you can find us. I do want to point out that we have a place for resources for providers, a place for resources for families. The website does have a translation feature on the top for many different languages. And also that on any page of the sites, you can look for that Find a Genetics Clinic red oval button, and that will take you to the directory to find a genetics provider near where you are. I want to point out that over the last year, we've developed sub-pages for some of our states and territories. Here you can see the page for DC, as well as the page for Puerto Rico, which has a great list of Spanish language resources. And here are the pages for Virginia and New York. I encourage you to check those out too, and there will be more coming soon. We are also increasing our efforts in the social media world. So far on Facebook, YouTube, and LinkedIn. We encourage you to connect with us there for current events, previously recorded content, and more. You can find our social media links on the NYMAC website. Those 3 red circles that you see there. We'll also drop all those links in the chat right now, and we encourage you to come follow us. So one new social media effort relates to the work of our NYMAC team of stakeholders in New York, who started meeting in the fall of 2020. Over the year together, they landed on education for families as their focus area with 5 key questions you see listed here. From those 5 key questions and the resources they wanted to share with families, they developed the infographic you see here in both English and Spanish, as well as small pocket cards that were distributed to provider offices across the state, and a series of social media ads. We're going to take a quick look at one of those social media ads, as well as some input from a New York team member about the value that she saw in having diverse types of stakeholders come together on the NYMAC New York team. And then we're also going to hear from Lynn Perry, a parent advocate from New York, about the value she saw in the collaboration on the New York team. What can you share with us about the value you saw in having diverse types of stakeholders come together on the NYMAC New York team?
I think the biggest thing for us as a team was having us all from different organizations, parts in the process, was that we all knew that there needed to be improvement, but we only could see it from where we were at. We couldn't see it from where everybody else was at. So having the diverse stakeholders let us look at it as a systemic problem and come up with the different parts of the system that needed to be fixed and work together to come up with a plan to address our problem, which we saw as families either not being referred to for genetic screenings or families not seeing the value in the genetic screening. So that was what we were tasked to do, and having all those people from different backgrounds made it easier so we could address the problem as a systemic issue.
So thank you to Lynn. I know she's with us today. Thank you for letting us share your thoughts on that. That was really important. So NYMAC also has a big focus on engaging with families and family organizations. We're honored to have so many of you with us today at this meeting from across the region. I mentioned that we work with the Family Center. We also collaborate with our regional family to family, parent to parent, and family voices organizations. We got great help from regional families on our website, social media, and the plans for this meeting. We have families that work on our NYMAC teams, lead team projects, and serve on our advisory committee. We also strive to engage with their work groups when it's helpful to them and support their educational needs around genetics. And during this meeting, we have 2 sessions about the value of collaborating with different types of stakeholders, including families, to help improve healthcare delivery. So we encourage you to check those out later today and tomorrow. A great illustration of family engagement comes from the work of the NYMAC team in DC. They spent a year together and landed on a project that focuses on supporting families and understanding the value and relevance of genetics and trusting the healthcare system. Their project includes recruiting families from DC to share their DC genetics journey and how they feel they benefited from their genetics appointments, so that newly referred families can hear the voices and see the faces of their neighbors when facing this new journey. We would never have been able to do this work without our close collaboration with the Advocates for Justice and Education organization in DC. I want to share with you the amazing invitation video created by parent advocate at AJE, my friend, LaJoy Johnson Law.
Hi, I'm LaJoy Johnson Law, Parent Support Specialist at Advocates for Justice and Education. But more importantly, I'm a mom of a child that has multiple disabilities. When my daughter Abria was first referred to genetic services, I had no idea what to expect. But once I saw the genetics team, they opened doors, got me resources, and referred me to genetic counseling and genetic services. So I'm in it to help other families explore their options on their genetic journey. If you have a story like mine about how meeting with a genetic doctor or a genetic counselor helped you and your family with a genetic concern, the New York Mid-Atlantic Caribbean Regional Genetics Team and Advocates for Justice and Education, also known as AJE, are inviting DC families just like you to let other families know and share your stories. Our goal is to raise awareness about genetics in DC and let families just know what to expect on this genetic journey and to help you feel comfortable. So let's work together to help families explore their genetic options. If you're interested, we're inviting you to take part of a video interview to share your story. Families that are selected to participate are going to be given a $150 gift card in exchange for their time. So thank you so much for your time. We look forward to connecting with you, and let's explore genetics.
Thank you to LaJoy. I don't think she's able to join us today, but love that video. That project is actually still recruiting participants. So if you know anybody that would be interested or eligible, feel free to pass that information along. Okay, so with many key partners and along with the rest of the regional genetics network system, NYMAC is increasing our focus and work around diversity, equity, and inclusion. You'll hear more throughout this meeting about our work in the territories and how their experiences can inform what we do in the continental states. These important issues are also a key focus of the NYMAC teams. We're seeking to work with more underserved communities to address unique disparities. NYMAC is engaging in work to expand minority student representation in genetics through a variety of funded and collaborative efforts. We have a focus on cultural dexterity and increasing health disparities and addressing health disparities throughout our work. We're lucky to have engaged with great teams of translators and interpreters for written materials and meetings such as this one. And we're looking forward to continued learning from the wonderful group of bilingual genetics providers we have identified so far. We're striving to consider diversity in our social media work as well. Later today, we're looking forward to an incredible workshop that will feature a panel of families and professionals who will share their unique perspectives about inclusive genetics services. And tomorrow, we're so excited to hear from Dr. Corey from the CDC about public health and equity in genomics. We hope you'll join us for both of these important sessions. I mentioned in the last slide that NYMAC is engaging in the work to expand minority student representation in genetics, and one of those efforts is the Genetics Opportunity, Learning, Development, and Empowerment Network, or GOLDEN. I want you to hear about this work from their founders.
Hi, my name is Barbara Harrison, co-founder of GOLDEN, the Genetics Opportunities, Learning, Development, and Empowerment Network. GOLDEN was created to encourage more African Americans to become genetic counselors by increasing awareness, recruiting, and providing mentorship. By reaching out to historically Black universities and colleges through lectures and participating in other career events, as well as focused social media marketing, we are spreading the word about genetic counseling as a career field. It is very important for us as African Americans to be represented so that our voices can be heard and the concerns of our community can be addressed as we move into the era of personalized health. And with that, I will turn it over to my colleague and co-founder of GOLDEN, Grace.
Thank you, Barb. So like Barb just mentioned, I'm the co-founder of GOLDEN, and my name is Grace Fassé. In addition to increasing awareness about genetic counseling among students, GOLDEN is committed to providing mentoring to aspiring genetic counselors. Once a student is interested in genetic counseling and their interest is sparked and they're excited, the hope is that that fire and drive will be enough for them to get into the field. But to be completely honest, it's quite a challenge. It's very competitive to get into a genetic counseling program. That's why GOLDEN is here to support and mentor aspiring genetic counselors into the field.
Thank you. A key goal of NYMAC is also to be a reliable source of genetics information. So in this cycle, some of the examples of this work include our website, English and Spanish language video projects, an online telegenetics planning toolkit, a series of documents about when to refer to genetics, and we're going to drop all those links below. Related to these topics, you'll hear some great educational sessions tomorrow about current and emerging treatments for genetic conditions, and also a panel about updates and perspectives on newborn screening. This year, we were able to hold 2 online trainings for families in Puerto Rico about genetic services. We were so lucky to reach over 50 families and got great feedback from families, including, "Thank you for providing us with information in a way that families understand." Our hope is to repeat this training in the spring, hopefully in person. Another great example of NYMAC education is the work of the NYMAC team in Virginia. During this year of work, they chose to focus on educational gaps that families and providers experience, and also hope to address some of the evident health disparities. The Virginia team chose to adapt an existing program that was developed by our colleagues in the Mountain States Regional Genetics Network called the Genetics Navigator Program. You can see here the topics that were covered in the 8 modules in the training that we did with parent advocates from Virginia just last week. I'm going to share some thoughts now from Jen Reese, who is both a Virginia team member and one of the advocates that did the training last week.
So I'm Jen Reese. I work for the Center for Family Involvement, and I am the Northern Virginia Regional Network Coordinator. So our group was, the diversity I think was a great value in that we had parents, we had doctors who provide direct care to patients, and then we also had some government employees, members of the Department of Health on our team. And I think even just with amongst the parents, the diversity was extremely helpful with our different lived experience. Lisa's daughter is almost 30 and is diagnosed with Down syndrome, which even 30 years ago was easily recognizable and identifiable as soon as she was born. My daughter's 14 years old, and we went home from the hospital with woohoo, 10 fingers, 10 toes, she's healthy. And that's not really what happened. A week later, things changed drastically. We did lots of genetic testing for 3 years before they even discovered her gene. And we always kept saying we had to wait for science to catch up to her. And so finally, when she was 4, she got her diagnosis of an epilepsy that's tied to proteins in the brain. And, just having answers and being able to find other families and just the difference in my experience from Lisa's, I think that helped our group a lot.
So over the last 2 years, most of us have had some experience in telehealth, I'm guessing. This is a big focus of NYMAC work. So I'm curious if you would share with us, have you provided and or received a telehealth appointment? And do you have questions about when you can use telehealth and when you can't, and sort of what the rules are? So you'll see that poll come up.
This is another one, Alissa, that people are answering pretty fast. This yes or no experience.
Good.
So in
Good.
just a moment, I'll notice when it slows down, we've got almost 100 people participating to answer this question. All right, it's slowed down. Last chance to vote here. Get your vote in 3, 2, 1. All right, there you go.
Perfect. So 80% have either provided or received. I'm sure if we had asked that question 5 years ago, that is not what we would have seen. And about a third of you have some questions about when you can use it. So good to know. We will have a session tomorrow about how to use telehealth and sort of lessons learned in that area. So we hope we will help you address those things. So on the whole, we've seen big successes with our telegenetics work. We've been able to impact a lot of providers through one-on-one navigation, professional training, and direct grant funding. We've documented a total of about 20,000 families having been seen by telegenetics in NYMAC supported clinics since 2018. As I mentioned, tomorrow we'll have a great panel of families and professionals to share lessons learned about telegenetics. So please be sure to check that out at 1:30. I've already shared a lot of information about our NYMAC teams in New York, Virginia, and DC. Across all of our jurisdictions, we strive to form a diverse team of collaborators. We try to make these groups represent a lot of different perspectives that help us understand how the genetics system is working in that state, district, or territory. We invite genetics providers, families, other healthcare providers, training groups, groups from maternal child health, newborn screening, Title V, industry, insurance, and others to join us in this work. In this grant year, we launched West Virginia and Maryland, and this summer, new teams will be formed in Delaware, New Jersey, and Pennsylvania. I'll also add that our efforts in Puerto Rico and the Virgin Islands will run over all 4 years. In contrast, our continental US teams spend their first year focused on defining the key challenges to accessing services within their state, especially for underserved populations. They focus on issues related to underserved communities, distance barriers, or education. The teams then brainstorm possible solutions and craft a project plan. They implement their chosen plan in the second year, and in later years look for further opportunities to monitor and impact access. Both today and tomorrow, you'll have a chance to go meet other people from your state, district, or territory during the first slot in the collaboration corner. I encourage you to go network with your neighbors during that time. To give you a sense of what we learn in these meetings, I wanted to share some of the local expertise that we gathered from Maryland and West Virginia this year. In these clips, you'll hear from Mary O'Brien from the Maryland team and Dr. Rebecca Barnett from the West Virginia team.
Great. The other thing I would want to mention too, and I know that it's also an issue for, not so much for Southern Maryland, although to a degree, but Western Maryland and the Eastern Shore have connectivity problems for internet. So that's a huge issue that although parents might be willing to do that, if they don't have the connection, or some families don't have computers or tablets.
I think one of our challenges, in Huntington is that we're so far from WVU, and we get patients from Eastern Kentucky and even, Ohio, where they're kind of right on the Ohio-West Virginia border. So a lot of families, sometimes, we start with WVU, but for them to even get to a satellite clinic or something, they end up going other places. And that's hard. And I actually run our NICU developmental follow-up clinic. And, I try to kind of keep tabs on these babies that are more complex and at least make sure that they are seeing somebody.
So NYMAC also includes, as I've mentioned, the territories of Puerto Rico and the Virgin Islands as of 2020. We're working on very similar goals there, with the development of local teams and a focus on education. And due to the staffing shortages and obvious challenges to traveling for care, a key goal in the territories is also to design a culturally effective model for telegenetics there. We asked some of our collaborators in the territories to share what they think is the most important thing that NYMAC should be focused on to support families that need genetic services in Puerto Rico and the Virgin Islands. Here is what Rosiani Sanchez, Dr. Norma Arceniegas, Maria Isabel Frankenberg, and Shami Carr shared with us.
That's a great question. And I think it's one of the things that NYMAC does best, which is to meet people where they are. And so at this point, since we just started doing this and we're in the first 18 months of our work with the territories, the most important piece is to ask them. So we are going to ask families, we're going to ask providers, and we've been doing that. So just focus on understanding rather than coming in with answers for them. Focus on understanding what they need from their own words and from their own places.
Our main purpose as a team is to be able to support families that need genetic services, not only in Puerto Rico, but throughout the nation. During this process, we have learned together what are the family's needs, especially on the island. The most that has been highlighted and on which we most continue to focus is having information related to genetics in their native language, using simple language, in addition to continuing to look for better options of how to increase the accessibility of services on the island with genetic counselors or telemedicine.
Okay, so I think that the education of physicians to create awareness on the reasons to refer and the red flags, and to have the index of suspicion that a medical condition needs and genetic assessment for genetic counseling. So it will be very, very, that is very important.
The most important thing that family needs in the territory, because of the differentiation of resources and allocations, is sustainability. Parents and families need resources that will stick around more than just months. And that's one of the beauties of NYMAC, because they look at it in a long-term situation. So I believe, my opinion is, sustainability is really the most important thing that parents and family needs, because they can count on it, not just for now, but for the future.
And thank you to our territory collaborators for that. We're really excited and hopeful about some possible trips to the territories coming up. During these trips, we're going to focus on building relationships and making progress on all three of our key goals there: our local teams, our educational efforts, and our telegenetics goals. So to wrap up, again, if we look at what NYMAC aims to do, we can see how the rest of our time together over the next 2 days will support that. Some sessions will really support our collaborative goals. We have a panel discussion to further our telegenetics work. 2 sessions will bring new educational topics to the table, as well as some great educational topics from our vendors in the mornings and lunch hours as well. And as all of these aim to support the overarching mission of access to care, we'll also have 2 other sessions tomorrow that look at new ways to deliver services. One looks at novel models involving primary care, and another at the use of genetic assistance and emerging technologies. So with that foundation in mind, what we'd like to do now is transition into small discussion groups to consider some important questions. So we are going to invite you to discuss in your group what you see as the biggest barrier that families experience in accessing genetic services that they need, and what could be some key solutions to these barriers. When you come back, we'll ask you to share one-word responses to these questions, which we'll visualize together in a word cloud. So you're going to see an invitation to a breakout room pop up. We encourage you to click on that to join a conversation. There is a special breakout room for Spanish speakers if you would like to go to that room. We'll come back together in a few minutes. If you do choose not to join a breakout room, I encourage you to still consider these questions. All right, so we are going to ask you guys to try to share in 1 or 2 words what the biggest barriers you guys chatted about in your rooms are, and what are some key solutions. So if you look in the chat and click on that link, it'll bring up a little tool. This is be your first experience with Mentimeter, but you'll see it throughout the day. So you're going to navigate over there. There's one link to share your thoughts on barriers and another link to share your thoughts on solutions. And as you guys share your thoughts, we'll be able to visualize that and see them come up and sort of build some consensus around what's going on. Perfect. So as we start to look at these barriers coming in, we certainly see cost and insurance happening. Distance to care for sure. General awareness. So yeah, we hear about awareness both from the perspective of families being aware that those services exist and the primary care and pediatricians who take care of the families kind of knowing where to send families that have those concerns. Internet access is becoming a much bigger an important issue as so many people are relying on telehealth, as we talked about before, and we will chat about some of the solutions that we've seen to help address that important issue.
Shall I move to solutions, Alissa?
Sure. Yep.
All right. Yeah.
Thank you for those, guys. And I appreciate the things that are coming in the chat also. So in the chat, there was a second link that will take you to share thoughts on solutions. Great. So a lot of these things that we're seeing coming up are things that NYMAC has at least had on our radar. So things like patient education, certainly telehealth to help getting to appointments be a little easier, telemedicine services you see again there. CMS recognition of genetic counselors certainly would improve access to care. Awareness campaigns, clone ourselves, TC says. Yes, exactly. We could have double the number of genetics providers in the region overnight. That would help a lot of things for sure. Educational messages that are simple. We hear that over and over again, that language and simplicity is really important. And not just for families, really for providers as well. Sometimes simple messages are best. And provider education as well. And we do hope to be able to provide that both to families and providers in meetings like this. Free satellite internet, yeah. Trying to get internet to areas where it doesn't exist, or even cell phone coverage isn't very good, is very challenging and important. Community trust building, that's a huge one. Well, thank you guys so much for those. It's really helpful to sort of see and hear from what you're experiencing in the real world and what you're seeing that actually is helping address some of these gaps. I wanted to share with you, we did ask these questions last year as well, and I'm seeing a lot of very similar responses. So some of the biggest barriers that were highlighted last year were cost, insurance, and internet access, which were the same things that you brought forth today. And then some of the solutions were education, which we heard about again, telehealth, people also highlighting things like equity and cultural brokers, libraries with computers. That helps us with our communities that don't have internet access. So it's good to see both the consistency from last year to next, as well as the new experiences and thoughts that people are bringing forward. So thank you for your participation in that. And as I mentioned, you'll see those Mentimeter polls come up again, and we're able to save these pieces of input that we get from you guys from one year to the next, and it really helps us shape the things that we need to be focused on. So as I wrap up the session, I'd love to ask those of you that have engaged with NYMAC in the past to share with us what difference NYMAC has made for you. You can share your thoughts and experiences in the chat below. I know a lot of you have already done some sharing about the roles that you've played with NYMAC and other things, but if there's other things that you'd like to share about kind of a change that NYMAC has supported you in, or other things that we've been able to help with, we'd love to learn from those things as well. Joanna's encouraging TC not to go to space. So we'll stick to that because I think the people in West Virginia need them there. I do see some people that worked with us on funding or education around telehealth activities, purchasing technology. I see a member of our Puerto Rico team bringing resources to the Virgin Islands. Hi, Yvonne. Just generally being aware that NYMAC is a resource, kind of where people that are new to us. I got to know Rose well on the navigator training that we did last week. Awareness and diversity of access to genetic services. Mabel has been a great part of our team and has learned a lot interviewing families from our state teams, which is a huge contribution to what the state teams process in regard to our needs assessment. So thank you to for that. Building networks. Lynn talked this morning about how she's been able as a parent and as an advocate to come through NYMAC events and learn from people and meet people that became really important to the path that her family followed. So building networks is a huge part of what we hope to do, and a huge part of the reason that we encourage so much interaction in these meetings, because you may come across somebody that really makes an impact in the work that you're trying to do. And Kendra commented that NYMAC has been a connection between the New York Department of Health and the community of providers, and we feel the same way, Kendra. We're really grateful that you've always been so willing to participate and keep us updated about what's happening in New York. And I did see you put in the chat earlier that the New York had some policies that are up for public comment, so people can check that out. And Lisa just did the navigator training as well. So thank you all so much for sharing that. I think it's really helpful for other people to see sometimes how taking the time to benefit, or taking the time to engage with NYMAC can bring things into your life. Hopefully that will be really beneficial. So as you go through the next 2 days, we hope that you'll all aim to take something away that can create change in building better access to genetic services. So we really want you all to try to find something that you can take with you into the real world that really will make an impact on what you're trying to achieve. And with that, I thank you so much for your time, attention, and participation. It was great to see and hear from so many of you. We want to invite all of you to join us in our mission in whichever way makes sense to you. NYMAC will be available to you in the collaboration corner today and tomorrow for any questions or discussion, so please come see us there. We'd love to see you join a NYMAC team, share a key resource with us, tell other people about NYMAC, attend our meetings and trainings just like this one, use our website, tools, and support for telegenetics, and follow us on social media. Our website and contact information will drop in the chat right now, and I am happy to answer any questions.